Good afternoon and thank you for joining us. This is KTN Newsdesk. My name is Yano Fuller. We do join you with the very latest news updates from Kenya and beyond. But first, let's take a look at some of the stories making headline at this hour. Uganda marks 53 years of independence with celebrations in northern Uganda. The impact will be long-lasting. UN warning on El Nino in East Africa. And stake rise as former Prime Minister confirms he's running for president in Ivory Coast. Welcome to the program. Just a reminder, our Twitter handle is at KTN News. Do let us know what is happening around you, and we also appreciate your feedback. Let's now go to neighboring Uganda, where today the people of that country are celebrating their Independence Day to commemorate the country's freedom from British rule in 1962. Uganda celebrates Independence Day with celebrations in different parts of the country, as well as other parts of the world where Ugandans have organized different events to mark the day. The main celebrations are, however, in northern town of Gulu, where the head of state Kaguta Museveni is expected to give the keynote address. Kenya is being represented in the celebrations by Deputy President William Ruto. Britain declared a protectorate over all present-day Uganda in 1894 and began to expand the reach of its control by invasion of Bunyoro in 1893 and 1894 and removing King of Kaberega, whose troops were pillaging territories that were under British control. These are live pictures coming to you from Gulu, courtesy of Uganda's Urban TV.
To celebrate this St. Mary's Hospital Lacho, Your Excellency. St. Mary's Hospital Lacho, nurses, staff, and members of the community of the hospital have joined you on this very, very important day. Gulu School of Clinical Officers, Your Excellency, have equally joined you on this day. Your Excellency, on a very, very positive note, we have the Gulu Contractors Association, Your Excellency. In a bid to ensure that there is quality of work, the contractors in Gulu district have come together and lead the procession is Udon Alex Okoya. Want to thank very much the contractors.
And following yesterday's landmark ruling in Kigali, Rwanda, analysts are urging President Paul Kagame to reject attempts to have him run for a third term. The calls come after the Supreme Court ruling cleared the way for a referendum on whether or not term limits should be removed in Rwanda. Aaron Ochieng reports.
Ignited the debate on ongoing trend on the continent where countries remove term limits to allow incumbent presidents to run.
There are things we want as much as anyone else.
President Kagame has himself not said he wants to run, but he has often said the people must have the final say. Some critics, however, remain to be convinced.
Firstly, he's had 2 terms of 7 years each. That's a long time. Secondly, he is the one who actually approved the term limits in the Constitution and is now trying quite, I think, insidiously to overturn them through a seeming public endorsement of his policies. While he has done extremely well economically, the democratic space in Rwanda has increasingly been closed down over the last decade. And that is dangerous.
Further west, Congolese President Denis Sassou Nguesso too is seeking to stay in power. DRC President Joseph Kabila too is being accused of attempting to cling on to power. This coming just months after violence broke out in Burundi following a similar attempt which appears to have succeeded for now by President Pierre Nkurunziza to extend his presidency.
Given that Mr. Nkurunziza's third term, as it were, happened on a constitutional and legal technicality, with his supporters saying that his first term was not really an elected first term, I think that unless similar situations occur elsewhere on the continent, it would not really set a precedent, as it were.
But across Africa, opinion is divided.
They should only stay for 10 years maximum. because what we've seen, they lead well in the first 3-5 years, and then they go their own way. Now they start looting the country, and they also put a new system that those who don't obey them, they don't benefit from them.
Sometimes he might know what is right for the country, but the people have the final say because it's their country, so it's their choice.
I think to a certain extent it depends on the type of services or their leadership, if it's highly received by the society or not. And definitely if they're doing something good, then they can have another term. But then if they are not, I don't think that they shouldn't.
This is a matter of principle. Yes, I think if a leader is doing a good job, there's no harm in his continuing, provided the people want him to continue. As long as he can stand for election again and win an election, signifying that the people want him, then there's no harm in being there for a longer time.
The Rwandan initiative will have to go through a referendum, but the decision has sparked off a conversation that could redefine how Africa deals with the question of democracy. Aaron Ocheng, KTN News.
And back in Kenya, stakeholders from the land sector are meeting to deliberate on the Land Laws Amendments Bill 2015. The stakeholders have raised concern that on the mode of prescribing minimum and maximum private land acreages, as well as the manner undertaking evictions from private, community and public land. The Institute of Surveyors of Kenya want the government to introduce a fee for undeveloped land so as to discourage persons holding idle land pieces of land.
There are smarter ways of encouraging people to own land, or to, for example, you can tax land. That would encourage them to develop land. You can tax idle land, for example. That's a smart way of tackling the matter than saying that you're putting a cap. Kenyans are hardworking, and it will be very difficult to implement this. That have been presented are attempting to rectify the anomalies that were in the other acts. The Land Act, you remember, the NLC Act and the like. You remember the spirit was for these agencies to work together. But what we've noticed over time has been a lot of, should I say, misunderstanding between the Ministry of Lands and Urban Development and the National Land Commission. I guess the spirit should be to work together. It should be to work with harmony to deliver to Kenyans. So this has been the biggest challenge for us, because when they're in this harmony, service delivery to members of the public and also for our members is very difficult.
We now want to cross over to Mombasa, where our reporter John Juma is on standby to give us an update on the Africa Governance Conference. John Juma, what is the latest?
Thank you, Ian. We are here in Kwale Leisure Lodge, where the African Governance and Leadership Convention has been going on since yesterday, and it's coming to an end today. The main topic of discussion today was surrounding or evolving around the health, the concerns about health, the challenges that health sector has gone through, not only in Kenya, not in East Africa, but in the entire continent. And among those who've been discussing this topic, we have delegates from Kenya, from other countries, Ghana, Nigeria, Uganda. And just to break it down to us is Professor Miriam Uwere from Moi University. Thank you, Professor, for joining us. Maybe first of all, what are the concerns raised in today's session?
Thank you very much, Mr. Juma. The concerns raised included the fact that we can have security issues arising from infectious diseases. And the presenters who presented this included Professor Katsuma from Japan, Professor Toromi from Nigeria, and Dr. Murindi from Kenya. And they gave us a very good breakdown on the epidemics that we have had in recent years. For instance, the epidemic that we just had in Ebola in West Africa. It's an infectious disease. It's a very dangerous one. It killed a lot of people. It devastated, it killed even health workers, and it devastated the health infrastructure. So it's a very serious concern. The infectious diseases are still a very serious concern as a source of epidemics, which then bring about a humanitarian crisis. The other concern that was addressed was the issue of how do we address women issues as a security concern. And this was presented from the perspective of where do you find most women and where would they be most at risk, say in Kenya or in Africa. And really, what we looked at the facts, most women are found in the communities which are rural and communities which are in informal settlement, so-called slums or peri-urban settlements. And these communities have women who are very who don't have much. They are not empowered in the sense that they don't have the information, they don't have the means, and so when an epidemic comes into their community, they are really terribly affected. So these are the two issues that came out clearly this morning.
Let's go back to the first issue of Ebola. It was a concern and the security is brought about. I'm very sure that even some of the investors had to run away for fear of the infection. How was it managed in Africa, and was it is it something that we can rely on if it happens again?
Well, it was managed very sadly. It was managed not so well. From many positions, the response came a bit late. The management came late, and even after the countries realized that this was a problem and they needed help, the help didn't come quickly. And this has been a serious problem in the sense that what we really lack in Africa is a state of preparedness. You see, like an epidemic, when it happens, it is very difficult to start from scratch and say, now what do I do? And you start from scratch. So we need to have a state of preparedness. Otherwise, as we were talking about earlier today, it was kicked out polio the other day. Now it is Ebola. So has polio disappeared? Or now it is. So it is a question of how should we establish a state of preparedness. And this is the problem that we had. And I wouldn't want another epidemic to be managed the way that Ebola was managed, because we lost far too many people. We lost too far many institutions. We lost too much economic development. There was too much disorganization as following. So my hope, and what I think Africa should do, and we can do it, is to be in a state of preparedness so that if we do have another epidemic, it doesn't become as serious and as deadly as Ebola.
Is it a question of a single nation, or are you trying to push for a unity of Africans together when it comes to curbing some of these concerns?
What we can do is to have a state of preparedness document regarding infectious diseases, and then every country should be urged to follow that state of preparedness. For instance, in my presentation, I made which was on how do we address the security issues of women in an epidemic, or for that matter, in a humanitarian crisis. And the point I'm making is that in countries which have got strong community health systems, it is easier for them to manage epidemics. Some of the countries in West Africa which have got strong community health programs, they may have had an infection of Ebola, but it didn't become an epidemic. You see, if you have an infection of just a few cases, it doesn't become an epidemic. It becomes an epidemic when so many people get affected. So what we should have is to have a state of preparedness in our communities. You see, Africa, the entire continent, has communities. Many of them are rural communities, but they also have communities in slums, communities in peri-urban settlement. And it is not like we don't know what to do. We know what to do. Pioneers like professors in Ghana established what they call CHIPS, community-based planning and services. It has been going on for a long time. In Kenya, we have had since 2006 the community health strategy, It has been going on for a long time. But the issue is that it goes on and then it is not followed up consistently. And like in Kenya, for instance, we haven't covered yet even half of the country with community health services. And many people came to learn from us in the 1970s when we were doing the original work of a community health approach. And those people, like Ethiopia, have now moved ahead and covered the entire country. So I would like to predict that if an emergency took place in Ethiopia now, I don't think it would be an epidemic, because they have covered every district, every community, every village through a community approach, and which is emphasizing a lot the prevention. So you have to do prevention of disease, then you have to establish in the communities a state of preparedness. When you see a case of someone who is sick, what do you do? And what do you do immediately? Not wait until the person dies and then tell somebody else, because by the time the person dies, he has already infected a number of other people. So, but you know, sometimes we just focus on expensive things, what we think is expensive, like machines, like this, like the other, and yet it doesn't help us to save our people's lives. And if I may go outside the communicable disease issue, an issue like damage from electronic waste, you know, now we are saying we are having a lot of cancer, we are having a lot of kidney disease. First of all, what you read in the press is, why is the government not buying machines to do dialysis of the kidneys? Why is government not buying machines to look after the cancer? That is a serious concern when your person is already sick with cancer or with the kidney disease. But the more fundamental question is, why are we having these cases? Are they increasing? Now, I don't know personally whether they are increasing or whether people are becoming more aware and therefore coming forward. But supposing they are increasing, why are they increasing? How can we prevent them? Can we prevent them, and how? You know, we are not dealing with that issue, because these machines that we are crying about, like radiation machine to help us manage cancer, they are not a game in the park. They are very serious machines, and they cause a lot of damage as they are trying to cure the disease. So the questions tend to be wrong. The first question should be, how do we prevent it? And then the second question is, if it has occurred, how do we manage it?
Professor, just on the same topic, one of the participants there spoke about it so passionately, about our electronic waste within our houses, and to what extent they could be contributing to this kind of diseases, particularly cancer. Do you think Kenyans and Africans at large know about the effects that the electronic waste may cause to them?
I don't think that people know. You know, people suck. You'll find children, they may be sucking batteries. They may be sucking some of the cell phones which are left lying around. I don't think people know. Maybe people know that it is not a safe thing, but they don't know how serious it is. So in that sense, I blame the professionals perhaps for not having this information. But the problem is that even if the professionals have the information, what is the forum in which they can give it? Because you find that some of this information, we try to give it at the health facility, at a health center or health hospital, or a hospital. Now, when you come to the health hospital or health center, you are sick. And you're not interested in hearing all this talk about how to prevent something, and you already have.
And Kenya Revenue Authority officials met with the business community in Nyeri in a forum aimed at bringing together key stakeholders to discuss pertinent issues on revenue payment. KRA officials revealed that Nyeri was among the top regions that were remitting their revenues, especially from the business sector. Other regions were also encouraged to faithfully pay their taxes, as it is the only way development can be realized. The forum was dubbed the Taxpayers Month Nyeri chapter. The business community had a chance to raise concerns that they had over revenue collection. Defaulters were urged by KRA to submit their dues in line with their tagline, kujilipa ushuru ni kujitegemea.
Sometimes, you know, we need a lot of food here. So far, Nairobi and Musyoka. on behalf of the business.
Ushuru ni uhuru. And countries around the world have realized that.
This country will be far. Our president will have a very easy moment to develop this country.
A portion of those taxes come to Nyeri County under the revenue sharing formula. And I think this year we have hit 4.4 billion from the revenue that is collected by KRA, which we are using to provide services.
I know Nyerians are compliant, lakini sasa pengine utuite on a Friday jioni. Sisi tunapenda hiyo mambo, alafu tusisimame sana na baiwe karibu. You're just returning something small to us. You're collecting 1.2 trillion. Surely, can't you afford 1 million for Nyeri? If we are the best paid, in fact, what I request the directors is apportion budgets dependent on how we collect, we pay. So don't give huko. Sisemi wapi 500,000, Nyeri mnatupatia 500, yet you're collecting several billions.
And screening of films in Nyeri commenced Thursday in Nyeri Town and will continue today at the Kenya Assemblies of God Hall. This is ahead of the Kalasha Awards, where the public will be given a chance to preview some of the films. According to the senior screening officer from the Ministry of Sports and Culture, Grace Kagwa, so far they have received at least 899 entries. The exercise is aimed at promoting the film industry in the region.
The total number of films submitted were 151 films, but in terms of categories, there were 899 categories. So out of those 899, we had 5 in each category. So after that, we go through the public voting process. We unveiled the nominees, which was done at IMATS last week. Then from there, after they are unveiled, we immediately go to the public voting process. To enhance this process, we do now public screenings in counties, and our first county was Nyeri. Kalasha comes from a Swahili word, which means the growing tusk of an elephant. So meaning this film is a growing industry. That's why we gave it the name Kalasha. And Kalasha is a major activity of promoting this industry, both locally and internationally.
And I want to take another short commercial break. We'll be back with more news updates.